Today I'm having my patient for the final checkup after a breast lift. And we're talking in English since she came all the way from Hong Kong to do the surgery. Thank you for your trust. And
I'm very pleased.
how was your decision made to get the breast surgery?
I was sitting on this decision and brewing for many years because I had 2 children, and I would say for the past maybe 3 to 4 years I've been looking for a plastic surgeon that I could trust, and I'm very pleased that I found you, Dr. Reiter. You remember that we discussed what I wanted, you had a look at me, and I just thought that we see eye to things. And I also very much enjoy the fact that you're a female plastic surgeon rather than male, because I just felt more, again, I feel more trust to women because we have a different vision of beauty and what natural looks and should look.
Yes, I agree. You came here and we met. Of course, we had digitally talked about the surgery and worked out all the details. And then you flew into Vienna and we met the day before surgery to get your size ready. Like we were talking a lot about sizes. You've also had a lot of thoughts about this.
My personal view is I never liked the aesthetics of big breasts. I think, and I also know from various friends who actually have naturally big breasts that it's a hassle, like it's an impediment to training, and I do a lot of sports, and I think I've always been actually happy with my size, and I think I had like a maybe C to D cup depending on stages of life and pregnancy. And I wanted to keep it that way. I didn't want to go any bigger than that. Also didn't want to go smaller. So my major concern is that I just wanted my breasts to be up.
So I brought you know them by now, so I don't need to explain to you, but for all the other patients to know how it works to check the sizes. Those are sizers that go in your bra. They are not real implants, but I can then calculate from the size you choose. You put them in your bra and you can get the feel of it, and when you feel well, and it was very clear with you. We put bigger ones and smaller ones, and feeling it on your body, I always think then it's very clear which size one can feel comfortable with.
Yes, I agree. Yeah.
We're finished for the appointment before the OR, and next time we met was already at the hospital in your room to then do the preoperative markings. The next you know, you're in the OR. Tell us about this. Were you nervous?
I was very nervous, and I think it's a factor of several things. I'm generally like a warrior. I was just afraid that I won't wake up, which I know it's a very small risk, but I was a bit, well, not a bit, but massively nervous about that. The anesthetist put in the IV. He is very skillful, very nice gentleman. I liked him very much. And then we arrived into the OR. I saw you, I saw the rest of the team. I immediately started feeling I think whatever it was, propofol or something else, because I stopped feeling anxious. Like the minute it starts dripping, like my worries disappeared. I was like, oh yes, I'm under drugs now. And then yes, I was given a bit of oxygen. That's what happened before I woke up.
Yes, and then my big part started. The surgery went very well. We did the lift, we mobilized the breast to put it back into position, and then I put the implant to add the volume and have a harmonic form. And then you woke up again. Yes. Already, we put on your compression bra, which you need to wear and which you're at this moment still wearing.
Yes, I am.
Yeah. Can you remember this?
I do remember how the interesting, the way you get back from the OR table onto the regular, not table bed, like it lifts you and then it's sort of you slide off it, because I've never seen it before. I thought, oh, that's an interesting bit of kit. I do remember when you came to check in on me, I said that my boobs are on fire. And then the nurse, I think you asked the nurse to give me the drip, and it took about 15-20 minutes for it to stop being the case. So, but when I say on fire, I could really feel the heat, but it wasn't something that I couldn't live with. And obviously I expected that I'm going to be in pain after surgery, so it wasn't anything terrible.
And then you went back to your room, you stayed overnight. This isn't always necessary, it was necessary for you because we did the combination of lifting and implants. You didn't have drains, most of the times we don't need it. And then the next morning I saw you, you were a bit tired then.
Yes,
and you were ready to go home. So now that you've have the hard part behind you, how do you feel?
In terms of recommendation, non-recommendation, I think it's a very personal choice for everyone. It took me, as I said, forever, and I would say that if I didn't find you, I probably would still be sitting on the fence, because unless you find somebody who you can really, really trust, and both in terms of safety and also, as I said, like in terms of aesthetics, because obviously when you're under, or even if you weren't under, you can't operate on yourself no matter how much you want. So you really need to trust the person. And as I said, like, because we were debating the size of the implants, and I don't know whether you remember, it's like, I trust your aesthetic choice. If you feel that I will look better with slightly bigger ones, go for it. But I prefer smaller ones. And yeah, so this kind of, I think, any patient who considers any plastic surgery needs to find this kind of trust with the doctor, and only then go for it, yeah. Which
is a great honor, and I'm getting goosebumps now also talking about it. Yeah, so, and I do feel that responsibility that you and other patients put in my hands, so I'm a perfectionist, which might be a factor in all this, and I'm really glad that we reached such a good result.
Me too.
So, thank you for sharing with us today. We might get you again in a few months to talk more about the long-term recovery. My name is Dr. Reiter. I'm a plastic surgeon in Vienna. And if you have any questions about breast lift, about breast reductions, about implants or other breast surgery, you're welcome to make an appointment. I will be happy to explain everything in detail.